prior to testing in humans, drugs must undergo an in-depth evaluation in cell or animal-based models. However, these models are only an approximation of the human body and have many shortcomings and limitations. By improving these models, we can better predict what happens when we give these drugs to humans, and this reduces cost and improves safety by allowing for more accurate and sophisticated studies in less expensive and high-risk models in the human body. My research focuses on improving the preclinical model for drug absorption through the intestinal wall. The majority of pharmaceuticals are administered orally, and the rate and extent of absorption through the intestine wall is a key measurement in the successful development of these products. Currently, there are two methods for making these measurements. One is a cell-based assay in which human intestinal epithelial cells are grown on a flat layer on a permeable membrane. This is a static system, and the evaluation of absorption of drug is made by adding a drug solution to one side of the cells and measuring the amount that's able to pass through the cells to the other side. While this lacks any of the dynamics and geometry of the live intestine, for a number of drugs it's actually a pretty good correlation. However, for drugs that have low solubility or low permeability through the intestine, this model tends to fall short. The other option is to do a live animal study in which a drug solution can be perfused through a live intestine, and the difference between what's going in and what's coming out of the intestine can be used to calculate the amount of drug that's being absorbed through the intestine wall and into the body. My approach is to create an in vitro environment that better recapitulates the live intestine without actually using a live animal. This both reduces the cost and the use of live animals in the pharmaceutical development. To do this, I have created a tubular scaffold out of a polymer membrane. The scaffold can be hooked up to tubing and a pump, allowing us to flow a drug solution through the lumen of the scaffold, just as you would in an animal perfusion study. We can then measure the amount of solution or the amount of drug that's going into the scaffold, that's coming out of the scaffold, as well as a direct measurement of the amount of drug that's passing through the scaffold wall and into the surrounding reservoir. The lumen of the scaffold can be coated with a layer of intestinal epithelial cells, effectively creating an in vitro intestine. Others' research suggests that one of the shortcomings in the current model for using intestinal cells to measure absorption in vitro is the lack of a physiologically relevant environment that leads to differences in intestinal cell behavior and thus permeability. We hypothesize that with our dynamic 3D model and tunable scaffold features, we will better recapitulate the in vivo environment, resulting in human epithelial cells that more closely resemble what's observed in the human intestine, and thus have a more accurate measurement of absorption and permeability of drug through the intestine wall.